Hello, good afternoon, everyone. Okay, so before we get started, I want everyone to just get up if you're able. We're gonna do a quick energizer to get people moving. If you're on Zoom, you can also get up. So please, everyone get up.
Yeah, I know this is academia, but the energy, y'all, come on.
So we can put both hands in the air. Now we're gonna go to the right, stretch it, feel it. Oh yeah, it's good for your mental health. And now to the other side. Awesome. I love it. I hope you guys feel better now. You got the energy because we're bringing it. Okay. So, as we mentioned, this next panel is going to be our panel on youth engagement with some fabulous youth leaders. We spent the morning hearing from experts across local and global stages, researchers about the evidence that tells us what young people are facing today. As Dr. Shoshana Fine mentioned, we need to listen and use the words that adolescents are using themselves. So this next conversation is really about what comes up after the evidence. It's about how we move from knowledge to action. And most importantly, how do we ensure that young people are not just consulted, but are co-designers and leaders in shaping their mental health? The truth is, young people are already leading this work. And we're here right now, right? So we're joined by three remarkable youth leaders who bring diverse experiences. And I'm excited to hear your thoughts today on what it really means to meaningfully engage young people. So before we dive into our discussion, I want you to each introduce yourself quickly and in 2 sentences, answer the question, what does meaningful youth engagement look like to you?
Okay, I think I'll start first. Hi, my name is Nikita. I'm a non-binary disabled researcher, student, youth advocate, and lived experience expert. For me, meaningful youth advocacy, specifically with mental health, looks like not just hearing youth voices, but also making sure that they have a voice.
Hi, everyone. I'm Jorge Alvarez, he, him. I'm a mental health advocate and have been for the last 7 years. Since my own crisis, I have lived and living experience because I'm still living my mental health struggles and challenges with anxiety and depression. I'm a social impact strategist, and full-time I work in partnerships at a national youth mental health nonprofit based right here out of DC. That being said, meaningful youth engagement to me is moving towards shared power and moving towards co-design and co-creation and shifting the internal power structures and infrastructure that is non-existent, in my opinion, at most institutions to really make sure that we're intentionally incorporating youth and young adult lived experiences beyond just the focus group and youth advisory council, which are a step forward, but not the direction that I think we should be leaning into solely.
Hi, everyone. My name is Diogo. I am a PhD candidate in the Department of Mental Health at the Bloomberg School of Public Health. I am originally from Lisbon, Portugal, so not the US, though I've been here for quite a while, as you can see in my accent. And my work focuses on intellectual and developmental disabilities. I'm the very proud sibling of an autistic man with an intellectual disability. And so my work is motivated by my lived experience and by my desire to help folks lead meaningful lives in their communities.
And what does meaningful youth engagement look like for you?
Yes, thank you for the reminder. I think useful and meaningful youth engagement to me involves us asking the questions of not just how young folks can advise our work and our practice and our advocacy, but how we can advise young folks in reaching their priorities in mental health care.
I love that. So I'm hearing something across all three of our youth leaders here, and that's really about shared power and what does that really look like in practice. So now let's unpack what it takes to make meaningful youth engagement a reality. Diogo and Jorge, when you imagine mental health in 2030 for yourself and young people, what does that world look like?
I guess I'll start. It's an interesting question because 2030 is not too far away. And because it's not too far away, my more cynical side is thinking about how much of the work that we're going to have to do is one of rebuilding. Both in this country, given what's been happening in the past few months, but also in many other countries in the world who are experiencing conflict, humanitarian crisis, and the rise of darker political forces. That being said, my more hopeful side is telling me that rebuilding can be an opportunity for us to build a better system. And so for me, a hopeful, more radical paradigm shifts in 2030 goes through two main avenues. The first one is to build systems where youth can engage with policy research and practice, both from the national level all the way to the local level. In my work in developmental disabilities, and I think I was reminded of this as people kept saying, nothing for us without us, which is actually a phrase that came about in the disability justice movement. And so I wanted to recognize that. And in my work in advocacy, one model, and I'm not saying that it will work for every situation, of course, context is so important, but one model that I've seen work very well here in the States are the state councils on developmental disabilities. So those are federally funded self-governing bodies where at least 60% of the members have to be people with disabilities or their family members. And they do all sorts of activities from informing policymakers to also interfacing with local organizations and building up advocates. And I think it's really important when we're thinking about giving voice to people to not just imagine it as putting someone in a panel or putting someone in an advisory council, but having that person and that council be its own self-governing independent body that has power in decision-making, power in organizing, power in advocacy. The other thing that I think is important besides building up these spaces for people to participate is to build up people to participate. In my own advocacy work, I had to be trained. I had to be taught how to engage with policymakers, how to educate them. And I don't think we ought to just rely on folks who are experiencing mental health, who have experienced mental health crisis or who have had contact with the system to be the sole torchbearers of reform and change. I think that invites us to only consider folks who have that facility with expressing themselves or no avenues to communicate or advocate. And we need to do better in reaching folks who don't.
Thank you so much. Jorge.
Can you remind me of the question?
Absolutely. So the question was, what does it look like in 2030 for you and other young people? What does mental health look like?
For sure. So I just want to build off of what you said. I agree, 2030 is not far, right? I mean, if I think about the context of our country specifically for a moment, our next election is what, 2028-ish, right? So it's like, that's what, 3 years away, and so much is being unraveled right before our eyes. And so I share your feelings of, of precaution, because I think it is difficult at this moment to feel as though progress is the direction that we're heading in. But I will say, I am really pleased to know that these conversations are happening across spaces. I've had the privilege of engaging rooms like this, full of academics and researchers and scientists. I've had the chance to have these same exact conversations, copy and paste with young people, advocates, organizers. And similarly, I've also had these conversations with folks in the nonprofit industry and policy. And so the fact that these conversations are happening around how do we meaningfully engage young people across these industries is something that I'm super excited about, and I think does give me a bit of that optimism. However, and I love that you credited the disability movement and justice space for that slogan. I think that slogan's also been co-opted in a way. And I'm not gonna lie, my hot take is I'm a little tired of hearing that slogan in some respects, because so often nothing about us without us is used by the same institutions that refuse to truly incorporate the opinions and expertise of young people. You might have well-meaning individuals on said teams within institutions, but so often these institutions are asking for our input, but are not prepared to respond. And that is the consistent trend that we're noticing. And so I think if I'm thinking, again, from an optimistic lens about 2030, and I'm thinking, okay, these conversations are happening across the spaces, but I've been saying that exact slogan for the last 7 years, and I haven't really seen, things shift in the way that they should shift. Then I'm thinking, okay, I'm hoping that within the next 5 years, 4 years almost, right, that there is an intentional, and you suggested this too, but an intentional investment in the infrastructure for young people's expertise to be incorporated in a way that, again, gives them autonomy, and that governance structures are also shifting to include youth voice. There's a really prominent mental health funder by the name of Hope Lab that I have a really strong relationship with in this space. And they recently just restructured their board to intentionally include a young person that has the same exact influence as any other old white, Gen Xer boomer on the board. And they have that influence. And I think it's important that we are building that infrastructure at that level. And I think that by 2030, we can start to create blueprints and share those blueprints out across industries on how to build that infrastructure. And I think that's a start.
I love that. Absolutely speaking truth to power there. So as we just heard, we are really in a need for rebuilding, repurposing, reimagining what these institutions really look like. We must not just include the young people, but make sure that they have equal shared power. And that's something that I keep hearing over and over. So turning it over to Nikita, in your own journey, what opportunities have allowed you to use your voice to be heard? And what barriers have you faced being meaningfully included in mental health spaces?
For me, opportunities have been spaces where they've not just included my voice as like data, but also included in making decisions and changes. And one such group that I'm involved as a lived experience expert is by Oxford University, where they're trying to look at how lived experiences can inform better research. From there, we can go on to policy. And this starts with us having a group of meetings that call a triangulation meeting, where psychologists, psychiatrists, humans researchers, all of them are in one group. And we all talk about themes that are determined and decided by the lived experience experts. And we talk about how and what difference that makes from each of our different fields. And we come up to one solution or one consensus to how we're going to then write a piece of paper on it. And then we act as also as co-authors and not just in acknowledgements, because we are taught how to write it. We're given resources. We're given resources on how to navigate academic spaces, and we're included in it. And I think something that also comes with this is the barriers, which is a burnout. I feel like as a lived experience expert, as much as I'm advocating for it and I'm out there talking about my lived experiences, there's also some burnout, right? There's going to be so much of you're talking about what you're feeling and or advocating for it. So that's something that's not quite acknowledged, and I think that needs to be looked into. Another part that I also think is for as a disabled person, my constraints are that lack of accessibility is understanding that disabilities look so different and that inclusion also could look different for different disabled people. And like for me, in digital spaces, it could mean that I sometimes don't get closed captions, and that could make me more burnt out, and that could be another accessible concerns. So I think that's been another barrier for me. And lastly, I think a word that's used quite a lot in the last presentation was cultural. And I was just going to talk about it, called cultural responsiveness practices, which I think, again, is not a conversation that a lot of people have, but I was so glad to see that in the conversation happening in this panel, last panel. And I think that is that we need to include how different cultures understand, look, and go beyond it, because everywhere culturally, mental health looks different. Like the terms that I use for mental health is so different from the context of the US. And to give context, I'm from India, if that's something I forgot to mention. And so in India, we use it very differently. And I think that's something to also acknowledge first. So for me, opportunities have been in spaces where it's more interdisciplinary. And I think that's a great way and a great step for us to start involving more young people.
Thank you so much for sharing that and just being brutally honest that oftentimes when youth are inviting into these spaces, we do get burnt out. We don't have all the answers. And it's a shared responsibility between experts who are youth themselves and the people who are leading this work. And so we must really remember that capacity building is important, making sure that young people have the tools to be able to participate, but also at the same time, really understanding that we don't have all the solutions. We bring our lived experiences and we burn out, and that's real. So thank you so much for sharing, Nikita. So moving on, Jorge, can you share an example from your own experiences where you successfully removed barriers to youth engagement when it came to mental health, and what kind of impact did you have?
Definitely. I also just want to quickly comment on what you just shared. I do think that, and we can always talk about this after, if we're intentionally building infrastructure for youth voice, I do think that that can limit burnout among the young people that you're engaging, right? So what does infrastructure mean? I mean building a dedicated pipeline for young people to participate, to again have influence, be part of governance. And if you do that, then it limits the tokenization of young people, and it limits us just sort of feeling like we're being exploited for that lived experience, which often is part of that burnout. I also just want to call out that right now, and I think I was going to mention this later in the panel, but I'll say it now. There is a really unique opportunity given that we have a government that is not listening to young people, that is censoring young people, that is listening to groups representing foreign entities and foreign interests versus the own needs of young people, to truly listen and respond. And so I do want to say, kind of building off of my last point, now is the time to listen and respond to our needs, and build that trust and that co-design and partnership with us now more than ever. To answer the question, I wanted to bring up one example. So prior to my full-time position at the nonprofit I work at, I was engaged by said nonprofit, which is Active Minds, if anyone is familiar. And when I was engaged as a youth consultant, social impact strategist, I was recognized for that lived experience and asked, hey, we're going to be developing this tool that a chapter of ours on a college campus had created, and we're going to try to repackage it in a way that can impact more people, more young people at a national scale. This tool was essentially a 3-step framework for young people in terms of for young people to know how to provide one another with emotional support. And so before that tool was, evaluated, and there was a new branding around said tool, which at the time it was called VAR. It was like validate, affirm, and I forgot the last thing. You see, it's not memorable enough. We were brought into the room and we were told, hey, we want to work with this council. It was like 10 of us. I don't want to take credit. In fact, actually, one of the folks on said group is a student here. But we worked together really intimately, and also there was research funded through MTV Social Impact, who was our partner, conducted in evaluating, the current state of young people in terms of our understanding and ability to support one another. And the one thing I wrote, because I'm not like all of you, I don't remember stats off the top of my head, here was that when we did said research, we actually identified that even though most young people want to be there for their friends and are more likely to turn to their friends, 70% of young people don't know how to support a friend. And when we found that, there was constant co-design, and we weren't just asked, hey, give us your opinions. We weren't just treated like a focus group, but we actually were able to say yes and no to the designers. We were able to say yes and no to the agencies that we collaborated with, yes and no to MTV Social Impact, when they suggested that we use the rebranded sort of acronym EAR, and we're like, no, that's not going to hit. We ultimately landed with ASK, right? So ASK, acknowledge, support, keep in touch. And so, fast forward, we launched this tool, we launched this digital training, we kind of created a campaign around it. You could have seen it at the VMAs, there was commercial spots, there were block parties. The corporate partner really elevated this campaign in a multitude of ways. But we were able to work with Harvard, Chan School of Public Health on an evaluation. And we found that after conducting the ASK experience and training, young people actually reported an increase of 11% of knowledge around how to support their friends. But also more than 90% said that you would use this with their friends. And the last thing I want to mention, which I think is quite promising, is that 2 weeks after, when we reached out to these young people, 9 out of 10 said that they not only felt comfortable and confident, but 2 out of 3 had actually already used ASK with their friends. I say this to say, this is a impactful campaign program resource that we not only had the chance to be part of shaping, but also instructed these stakeholders on how to even engage us, and furthermore, how to engage these young people in the research itself.
I love that. Thank you so much for sharing that example. I think that's a brilliant example of how when you work with young people, you actually create products and interventions, policies, practices that are used by young people. And if we're really trying to improve youth mental health, we have to include young people in all the processes, as we've heard over and over again today. So one thing we do have to remember, and Nikita, I'm so glad that she brought this out, is that young people are very different. Well, humans are all different, and we're all coming from different experiences, different cultures and contexts, different skills, disabilities, et cetera, et cetera. And so what does inclusion really mean? What does that look like? How do we create inclusive spaces? And I'd like to hear your thoughts, Nikita, on how you think mental health spaces can better include marginalized and underrepresented young people, like those from rural or urban settings, or those with disabilities, as not just participants, but actually engage them.
Oh, thanks for the question. I feel like something that I want to point out is that I love the words that we've been using, co-creating, working with spaces. And I think that itself, that languaging itself, I think is a great step to inclusion. And I remember the work that I was doing in India as a co-creator with Grow Mental Health in India was that we were starting to say co-creators to all the youth that were involved in it. And I remember that itself was so empowering to us. So thank you so much for that question. And I think to include, I think we need to start from understanding that when we're building spaces for them, we need to include them from day one. Like instead of getting them in the middle of the process of like, oh, this is how the process of program and goals look like that we want to engage with these communities. Let's just start from day one saying, hey, if we want to start this program or these resources or this support for these communities, how do we go forward with it from day one? And I think another thing that is important that I think I've probably also mentioned again is that when we're trying to talk about underrepresented population, it is to understand that different communities understand mental health very differently, right? And I think it is to first design these different communities. And I think in the last panel also it was spoken on cultural responsiveness practices. Again, another favorite term of mine that I think I constantly use a lot is because I don't think we can always generalize how our concerns are. And I think that is to understand how different cultures are responding differently. And so we need to start with programs that are for different cultures and that works for them and cannot work for everyone, even if there are similar patterns of concerns and similar patterns of solutions probably for that matter. And another thing is for disabled people. And I think I would again and again resonate, and I would probably vocalize this aloud, is because disabled people need inclusion that looks different. Inclusivity looks so much different. I've heard so many people that are telling me, oh, you're disabled, so, oh, you might just need an XYZ, but disability goes beyond it. I think it goes beyond like having interpreters when needed, or having, everybody included with whatever, accommodations required. And my last point in inclusion would be language. As a multilingual person that speaks about 4 languages, I cannot emphasize on how English is not my first language. And so if I'm talking about mental health concerns, although now I'm a graduate student here and I speak English and I'm able to write English well, not all the communities and the people I represent are able to do the same. And I think when we talk about mental health, it's that having them to speak in their language and then probably having help of community people who are able to speak both these languages or are multilingual, involving them in it is really, really important. Because I can tell you in English XYZ, but in my own language, this could mean so different to me. And the power and the impact that I'm talking is going to be extremely different. So I feel like language is another important aspect. And I think once we are able to look into these little aspects of where they come from, the spaces they are in, the language they speak, and the kind of disabilities that they could have, I think that's when inclusivity of marginalized communities can happen.
Awesome. Thank you so much for that. Diogo, do you have anything else to add around including diverse voices in this work?
A couple things. So yeah, I just want to echo what Nikita mentioned about accessibility of disabled people. It is something that, specifically in research spaces, we don't do very well, to be quite honest. We don't think about things like translating our documents into plain language, interpreters, sign language interpreters. We don't think about providing, even when we do participant panels or we try to do community-based participatory research, we don't think about different ways to participate, remote, in person, etc. So I do want to just highlight that. A couple of things. First, I think education is really important. And by that, I mean mental health literacy should not just be about signs and symptoms and disorders and how to identify them, but also about the services and how we access them. Because I think that's the first part in building an engaged youth base, an organized youth base, is to tell them this is how the system works, this is how you would access it, and this is how it may fall short, including things like wait lists, some difficulty and shortages of staff, all of that. The other thing that I think is really important is paying people. We pay adults for their expertise, and we are asking youth to provide theirs. Part of respecting people and their autonomy and their expertise is to pay them for their time. If we rely solely on volunteering to get this engagement, you're going to get a slice of youth who can afford the time to volunteer. And necessarily you're getting a biased perspective of what mental health access and experience is like.
I'm so glad that you brought it up. I 100% agree with the fact that we need to pay young people for their expertise. So does everybody in this room feel like that's important? All right. Okay, we got something done, guys. So yes, I love what you mentioned about increasing access and what that looks like, and the education piece and the respecting young people's expertise and paying for it. I think that's all really, really important when we think about how to meaningfully engage young people. So thank you for those important points. So a lot of research is about young people and not with them. So Jorge, I would love to hear your thoughts on how we can ensure evidence is acted upon with youth at the table.
Yeah, thank you so much. So again, I'm going to sort of build off of the previous example that I was sharing, since that I think is just like one of the best experiences that I've had. I think for me, what was really powerful was not just supporting the sort of shaping of the questions that were initially going to be used in said research, but also when the research was conducted again by these two partners, and it was brought back to us first to say, does this reflect your experiences? And it was asked for us, or we were given the opportunity to also add our narrative, and not just add our narrative, but tap in other young people to bring some of this research and some of these statistics to life. And so for me, I think I mostly answered this particular question previously, but I just want to emphasize the power of not like taking it a step further and making sure that you are collaborating with young people to think about how do we also, to your point, make it more accessible, like make it make sense. And so for instance, like what I read off is an example of like what we helped sort of shape. Initially, it was not written like that, as you can imagine. There's a few words I had to Google. But I think that is like a really important step forward to keep that short.
Yeah, and I think even at this convening, right, the language that we're using, we have to ask ourselves, is it inclusive? Can young people actually understand what the research is that we're trying to present? I think to make plain language what we're trying to say can really move this evidence into action. So really think thoughtfully about how you're presenting and sharing your data.
Tina, I just wanted to add one more thing.
Yeah, go ahead.
That's exactly what we were doing in our lived experience group as well, that we just brought it up, that, hey, this research is great, but we don't understand a word that's spoken. So how are you going to include us without we understanding a word about it, right? And so we actually made this change, and we had this policy in our lived experience expert, conversations, that we need to have more people understand these things, have plain English summaries written down, have a dictionary of words that we'll probably get to use and we don't know about, that we'll have to like understand a little bit more about. And also let researchers have some training on how they can engage with lived experience experts, because as much as we want to engage with them, they also need to be able to engage with us, and they need to also be trained, because far often the meetings that we had with the researchers, they would just go on with like, research in the background and this is the data. And we would just stand there like, we didn't understand a word. So I guess that is also training that researchers need to be done for engaging with us. So I just wanted to add on to that.
Thank you, Diogo. Do you have anything else? Because I feel like we're fired up now.
Yeah, I do actually. Community-based participatory research has been something that I've been thinking about for a long time. We've talked a lot about accessibility and the work that individual research teams can do to include young people, but I also want us to think about collective action because the incentives to do this type of work are not there. And this work needs time and it needs funding. And for that, it needs recognition. So I urge you, many of you are in research teams in universities, to think not only about how you are including young people in your work, but also how we push funders and the people that are really sitting at the top of the research ladder to recognize the importance of this work. Yeah, lots of you are editors in journals, are reviewers, are in panel sections, and I urge you to bring that into those spaces so that we can change the infrastructure, the incentive structure to reward this type of work.
Love that call to action. And I hope everyone in the room heard it. Did you guys hear it?
Yeah.
Awesome. So make sure you tell a friend to tell a friend. Okay, so we've explored meaningful youth engagement, the barriers, what inclusion looks like, the evidence to action. Now I would like to wrap up from hearing each of you. What's one thing you want everyone listening in the room and online, especially decision makers, to take away about how engaging young people directly can drive meaningful change for youth mental health? What's your one key takeaway? This is your time.
I can go ahead. So I think for me, it is understanding that youth are not just stakeholders, but they're innovators. And I think that itself was like so empowering for me. When I was thinking about every time I've been asked this question as to like, what is one thing that you would want to tell us? And I would tell them, we're not just stakeholders, we are innovators. And the moment you think about this sentence, I think you realize how involvement of ours is very important for conversations about us. Like you said, nothing without us being a part of it. So
No, honestly, I feel like everything I want you all to walk away with, I kind of said. So I hope you walk away with all of that. But I wanted to quickly say, also think of us, you're working with us because we are like the trusted messengers amongst ourselves, like amongst our peers. And I just want to share something that like literally happened yesterday. Sometimes I'm reminded that no amount of research, no amount of resources and programs will ultimately resonate with certain folks. It's truly the neighbors and peers and community that can reach certain people. And yesterday, I had someone who I met in my Satistat dance class. That's a fun fact about me. Who's a straight Latino man, and that's important. Because he texted me yesterday and he was like, "Hey, thank you for the therapy rec. I just signed up." And I was like, "Oh shoot, like that's huge." And that reminded me. I'm like, I remember having a conversation with him over Cuban food, just like talking about therapy in a way that I knew would make sense to him, but I didn't know if he walked away with the main points. And I say that to say, when it comes to collaboration, again, we are the true, like we are immersed in the day-to-day. I'm not here saying I'm focused on communities. And then I go back to like my 6-figure, 7-figure home and don't have the lived experience. I'm navigating this. I'm having conversations with the folks who are impacted day in, day out. And I think we, as a collective, a lot of young people, especially of marginalized backgrounds, are super important to tap into and to really, again, develop that partnership with.
Maybe I should have saved my call to actions for now, but if I have a key takeaway, a lot of this work, even though we're talking about, global mental health and national structures and national infrastructure, a lot of this work is local. It's context-based, it's community-based. And so I think it is really important to be meaningful and present in your community whether you're a researcher, advocate, or policymaker, and engage youth in your community. Because you're best positioned to understand the context and to directly engage those people that will have the lived experience that will inform and, I trust, improve your work.
Those are some powerful messages. Thank you so much for sharing that. So what have we heard today from these amazing youth leaders? One of the things I've heard is we have to be intentional about building infrastructure that creates shared power with young people. So not just, again, tokenizing, bringing one or two voices, but actually creating positions in research, in policy, in practice, where there is shared influence when it comes to a young person's participation. Also heard a lot about capacity building, because especially when it comes to a space like research, there's a lot of young people who don't understand the language, who don't really understand what it looks like. And so being very intentional about capacity building of these young folks so they can actually meaningfully participate. I think one thing I heard is that when we're thinking about youth engagement, we also have to think about burnout. And I think youth engagement is, you can't expect so much. I think it has to be fluid. Like, what can young people provide? You have to ask them what they can do or what they're willing to do, and then move from there. I've heard a lot about plain language and, meeting young people where they are, using the language that they use that could look very different in research that we're used to. So paying attention to that. Paying young people for their expertise. Again, young people are experts in their own right. And I think that's something that we need to continue telling people, right, young folks? Yeah. And I love that there's young people in this room. And one thing that really stuck out to me, Diogo, is you saying that, work with the young people in your community. There are young people who were intentionally invited to this convening because they are experts in their own right. And they are doing this work. They care about their mental health. We've seen in the data from the Lancet Commission that mental health for young people is a really big priority area. And so I encourage you all, as this panel is wrapping up, to speak to the young people on this panel and in this room about what they need. What does mental health look like for them? How can you help? And how can you use your positions to really advance youth mental health? So with that said, I would love to conclude, and I think this was amazing. And I thank you all for just listening. I think that's a really big part of all of this, is just listening to what young people have to say. So now I just kind of want to see, to get a little bit of the room, do you guys feel confident a little bit more in including young people in the work that you do? Can I get a raise of hands if you feel a little more confident? This is live research, okay? Awesome. Well, thank you so much. And yes, please do talk to us.